Today we have Sam once again getting ozone dialysis. Sam, as you know on the website, he's been there for the 10 pass. Now this is a little different than the 10 pass. It's ozone dialysis. It's not really dialyzing the blood per se, but it's filtration of the blood and the ozone. So it's going through a filter system. So it's called ozone dialysis for that reason. So we're not doing any kind of kidney dialysis. We're using ozone dialysis of the filtration. Now this is, according to Robert Rowan, this is designed to give about 6 to 7 or even 8 times more ozone than the 10 pass. So you can do it in a very short time, between 30 minutes to 45 minutes, even up to an hour, if the patient can tolerate it based upon the flow. And you can actually get a great treatment where the patient feels fantastic. So basically, you have a medically grade oxygen, once again, oxygen tank, and that's feeding the ozone generator. You have a setup where you have an in and out. You have to have very good veins. So you have large veins. Sam has 18 gauge in one arm and a 20 in the other one. So you got a good out and a good in. So this arm here is the red line, which is the outflow line from Sam into the pump system that goes through the filtration. The ozone goes through the machine here to this tubing. It goes through the membrane and it actually ozonates the blood as it passes through the system. And you can see definitely different, because if you look at the blood is from Sam going out, which is a purplish dark red, and the blood going back after it goes through dialysis filtration into Sam is a cherry red. So this is the ozonated blood. This is the one coming from Sam, and this is the cherry red that's going back into Sam after it goes through the system. This is heparin that actually flows through the system here, and it meets the blood before it goes through the pump system, and it gets into the dialysis system to get into the filtration. When we do this, we make sure we monitor the heart rate and the saturation here, and then you also monitor the blood pressure. The blood pressure is really nice, and oxygen saturation is also very nice. You're very comfortable sitting there, and then basically you let the machine do its work. This is actually an easier treatment than the 10 pass. Because remember, in the 10 pass, you do a lot of mechanical turning and swirling. This here happens by itself. The downside is that it's a bigger setup. So you have to have a setup time. It could take between 15 minutes to 30 minutes to set up, where, the more you do, the quicker it gets as far as setting up the system. And once you get it all set up, it looks kind of a little scary, right? Blood going, out of Sam, through the machine, into the filtration, and back into Sam. That's basically in and out. Once you do that, basically you have to now be vigilant. So now you watch the blood in this bypass chamber to make sure it's dripping at a nice rate. Sam is going at 40 milliliters per minute. You start off initially at 30 milliliters per minute. Most patients do 30 milliliters per minute. 30 milliliters per minute. Sam, he's ozone, ozone champ. He's had ozone before. Number 2, he has large veins, so we can increase it. We went from 30 to 40 milliliters per minute. We also changed the amount of concentration of ozone that goes into the system. We started Sam at 10, and we went up to 20. The max that I recommend that you go up to is about 30. And once again, we kind of keep Sam in between in the middle there, so he's going at 20. So he's going at a pretty nice clip at 40 milliliters per minute through the system. It gets ozonated through this here and gets back into Sam. And that's pretty much ozone dialysis. We keep heating blankets on him to keep him nice and warm because it gets a little cool. And to make sure, how you doing, Sam? How you feeling?
Feeling great.
You're feeling great?
Yes, sir.
Well, Sam, you'll be able to give us a little comparison as far as how the 10 pass went on Friday, if you had one, and how you feel with the ozone dialysis today. So I know that you feel like you're Superman sometimes, without the cape, but hopefully, we'll be able to get some good feedback from Sam.